Hey everyone, thanks so much for joining me on the Slice of Healthcare podcast. I'm your host, Jared Taylor. Joining me today is Andrew Lockhart, the co-founder and CEO at Fathom. Andrew, how are you today?
I'm doing well. Thanks for having me on the podcast, Jared.
Excited to have you here. Let's dive right into it. If you could tell the audience a little bit about your background, I know they'd love to hear that.
Yeah, so background wise, I might be the worst candidate uh, to start a medical coding AI company you can imagine, in that I have no computer science background. I'm actually Canadian, so I don't know that much. Well, didn't know much about the healthcare system, and didn't really know what medical coding was up until about 6 months before we started Fathom. Um, Prior to starting Fathom, I'd been a serial entrepreneur. I'd been starting companies my entire life. I'd come out to Stanford for business school and also to get immersed in the tech ecosystem. Prior to that, I'd been starting companies, but my background had been primarily as a designer. And so, uh, you know, what I realized is that through some design projects I had worked on before coming into the business school is that I found the U.S. healthcare system to be endlessly fascinating and complex. Just the layers of dimensionality, the number of problems to be solved, the sheer scale is daunting, but also very exciting to me. And uh, after finishing my MBA at Stanford, I'd started a couple companies in the natural language processing domain, had not had the courage to venture into healthcare. And finally, you know, we, my co-founder and I sort of decided to jump in with both feet. And actually the funny thing and interesting thing about Fathom is we started out as a completely different business. We were an on-demand pharmacy, which we very quickly realized would never become a true tech business. Looked a lot like your direct to consumer e-commerce businesses with maybe some additional regulatory hurdles, but we didn't feel we were the people to build that company. And so we course corrected. And at the time, my co-founder, Chris, he really had the insight to that the intersection of deep learning and natural language processing was about to become very exciting. We were probably a couple of years early on that thesis, but healthcare takes a long time to come to fruition, and so it ended up making sense. And then fast forward to today, we're now supporting some of the largest revenue cycle operations in the country. We probably handle about 15% of all emergency department cases in the country today. Anything I missed? Anything you would like to dive into there?
That's impressive. No, you explained everything perfectly. Uh, you sold yourself short for saying you're Canadian, and you probably weren't the best candidate because you had unique experiences that, although maybe in the early days didn't directly correlate to like starting a company like this, that still played in really well to what you've built today. When we talk about what you've built, I'd love for you to highlight some of the revenue cycle management kind of market challenges that maybe exist when you started and still exist today.
Mm-hmm. Yeah, so I'd say the revenue cycle market writ large is still enormously challenged. It's people powered, and maybe to unpack what I mean by revenue cycle is whenever someone ends up in some sort of care setting, how does everyone get paid, and including how does the patient pay their copay, how does insurance end to end, it is still basically stuck in the 70s and still holds a lot of it has about 12 steps end to end, and it really should be three. The technology is now here today where I think we're going to see massive transformation. Um, but it remains very archaic. But you take something like Fathom, which essentially, for those that aren't familiar, medical coding, what it is codifying the language that physicians and nurses use to describe what happened in the care setting into the codes necessary for reimbursement. Um, the thing that has me very fired up about Fathom in the long term is I think it has the ability to abstract away that entire revenue cycle process. So, like 15 cents on every dollar in the US healthcare system, some people estimate more, some people a little less, is spent on administrative costs. I think a technology like Fathom um, at scale has the potential to like knock out 10 cents.
Super interesting. And you have, so Fathom claims to have fast and easy implementation of uh, AI medical coding. Talk us through what that means in terms of AI, right? Uh, AI in healthcare has been discussed and has been implemented over, the last several and many years, even before that. But just overall population, it seems like it's been talked about way more today with like chat gpt, right? Like you go up to a random person on the street, they know. Talk us through your AI medical coding process, like how this all works. I know our audience would love to hear more about that.
Yeah, so I mean, building Fathom was a real journey because basically the approach we've taken to medical coding automation is deep learning. And the underlying premise of deep learning is that you throw a whole bunch of data, at basically compute power, supercomputers or cloud computing, um, with a question and an answer, and then it learns to generate the answers itself. It effectively writes all those rules. So historically, most kind of NLP automation stuff, you had huge teams of analysts trying to figure out how to write enough rules to capture basically all the different ways, the tens of thousands of providers in the country might describe tens of thousands of diagnosis codes, which is an impossible problem. And really, the only way to truly solve it is deep learning. And the hard thing about that is you need an enormous amount of data. And really, the early years of Fathom were very much Charlie Brown kicking the football, and that me finding someone who would be willing to work with us, send us a lot of data, and we turn out, oh, it's not enough. It's not enough. And fortunately, we were able to partner with some very large organizations that were able to essentially, I'd call them like physician groups, billing companies, aggregators that had this sheer quantity of data that would basically, you know, supply the engine with the data it needed to basically explore all the nuances of these codes.
Thank you so much for giving us some more info on that. And when we look at the, you told earlier in the conversation, you talked about the market challenges, right, that existed in the beginning days and what still exists today. What's when you look at the state of AI medical coding, throughout the industry today, what's the current state of that, and what do you see? I guess how do you see that continuing to evolve? I know you mentioned what you would like to see happen in the future, so I'd love to hear more around what you envision happening, let's say in the next like 3 to 5 years.
Yeah, I mean, the very easy starting point is just what Fathom automates medical coding is experiencing a very pronounced labor shortage. So, medical coding today is either performed by the nurse or doctor themselves, which is frankly a terrible scenario because they're very expensive people and you're having them do a job that they're not particularly good at and they don't like in an environment where provider burnout is a very real thing. And then there's another group of folks, about 140,000 folks that support the US healthcare system who are specialized medical coders. Um, both populations are in extremely short labor supply. So what we're beginning to see is health systems coming to us that are telling us, they're not able to send claims out the door till 35, 40 days after the visit, just because they don't have people to do the work. Which in a world of rising interest rates and frankly, like the financial situations of most health systems have gotten much more difficult throughout the pandemic. This has become really challenging. And so what I expect to see is that over the next 3, 4, 5 years, AI is going to be performing, I'd call it certainly 90 to 95% of outpatient coding. At the end of the day, it just makes sense. The very interesting thing in our journey with Fathom is when we got started, we felt we could build a system that could be just as good as people obviously be a lot less expensive and faster. Um, the state of the art and underlying technology that powers Fathom and similar companies has gotten so good that not only is it less expensive and faster, it's actually much better. And higher quality coding results not just in fewer denials, which are expensive to deal with and oftentimes just account for lost revenue, but also actually more revenue pickup because the system is more systematically identifying all the underlying code. So, if you have folks in, say, a uh, sort of risk-based contracts, catching each nth ICD code is enormously powerful leverage. Another thing we often see is like a physician might document a procedure they performed in a strange place in the EHR that coder might not be used to looking, but the AI is going to spot that and make sure that code's captured.
And in terms of what you're excited about and what's next for Fathom, what can you share with us here today? That I know there's certain things you probably can't share, but what can you tell us that's exciting you in terms of what's next?
I mean, really, it's funny because candidates ask me and they're like, "Oh, like what is the big thing we're doing?" Um, and it sounds sort of unimaginative, but it's just like more of what we're doing. So higher automation rates, broader specialty coverage. Uh, probably by middle of this year, if you take the average health system, Fathom will be able to code almost 80% of outpatient encounters autonomously. And just the scale of the potential impact of that is enormous. One of the reasons why, when my co-founder and I pivoted from the pharmacy to where we are, we specifically decided to tackle the administrative side because we felt like the clinical side is very difficult to scale because those care environments are very idiosyncratic. But the administrative side, because it's largely normalized by essentially CMS, there's opportunities to like have massive impact and scale very quickly. And that's really what I'm excited to see play out.
Well, Andrew, I want to thank you so much for joining me on the podcast here today, sharing your story, telling us about Fathom, and excited to see how it continues to evolve. Hopefully, we can have you come back on again in the near future, maybe get you on a panel and talk more about this, but really appreciate you being a guest.
Anytime, Jared. It was a pleasure.